All right, so, wow, it's an honor to be here with you all, and thank you for coming out this morning. So we're gonna be talking about, so by the way, my name is Marcia Perretto. I'm a doctor of physical therapy. I practice in Boca Raton, Florida. I'm also a patient, discombobulated, like most of us. So we're gonna be talking about keeping realistically active and adaptive exercising for when living with EDS and HSD. Let's see. And this is not moving. Talk about clumsiness here. There we go. All right, so let's just do a quick recap here. Behave. Okay, let's start over. Talking about a little recap here. So what we are looking at when we have Ehlers-Danlos patients is the alterations to the, or we have recognized and unrecognized, yet to be recognized alterations to connective tissues, body, of the body's extracellular matrix. So it is, and now the screen changed. And now, so it is an associated or abnormal extracellular turnover associated with altered signaling events. Leads to what? To changes in or pro-inflammatory mechanisms, which will lead to cellular dysfunction, which will lead to more extracellular matrix damage, which becomes a vicious cycle. And that vicious cycle, we are going to have a compromise to the structure and functionality of the different connective tissues, which will lead to the multisystemic presentation of the EDS and HSD patients. So what I try to do here is give you guys more practical advice. I think my colleagues have done an amazing job showing all the research and all that. So I went into the research and I pulled what is more relevant for us, and I'm bringing up 4 important points that I would hope you guys to take home with you today. So let's look a little bit at the tissue tolerance and tissue adaptation. And so the physiology of it, or how it works, is the importance of progressive loading to strengthen connective tissue. What does that mean? We need to load it progressively so we make it better and better. This adaptation will occur only with consistent and moderate stress added to the tissue over time. Now, yes, what happens is that we have a weaker connective tissue, right? So if we overload a bit too much, it ends up causing a little damage, injury, we're back to square one, and we kind of get stuck on that loop sometimes, right? So we need to make sure that we have a careful exercise dose and progression to minimize that tissue injury, right? And there are other external things that can affect that, not only the stimulation of the exercise, but the day-to-day activity, how we slept, how is our nutrition. All that is a piece of the whole picture that we need to think about, but we're gonna just try to focus with one thing here today. So a little quick look into tissue adaptation timelines from normal connective tissue versus the tissue in EDS and HSD patients. So you guys can appreciate that we have actually almost double the time in certain phases compared to a normal tissue. So that means what? It means we need to be extra careful, right? Not only we're more delicate, but we also take sometimes twice as long in each phase. And that in mind as well that we have those phases in the body at the same time in different tissues. Okay, so we're not only transitioning from one to the next as a steady entire body. So let's look at proper exercise dosing and the frequency and the loading of it, right? So key principles, less is more, right? We are not gonna be jumping in and like, I'm making this very long exercise program, and today's the day that I changed my life and we want it to be. Making the decision is always the first step, but obviously start slow. Start with less repetitions. It's not that you're cheating yourself for doing less. It's you're doing what is right for you. So if you start with 4 repetitions, if that's right for you, that's great. Because if you started with 4 repetitions and you did a couple exercises, at the end of that session, you did 25, 30 repetitions, right? If you do less sets or more sets, that also counts. So pay attention to how you feel after the exercise. Pay attention to how you feel after that session. You want to have done a nice session to where when next day you wake up in the morning, you feel good. You might feel a little something. You might feel like, you know, I feel like I exercised yesterday. But you want to feel good to the point that you can do something next day. You don't want to be wiped out. Then you're down for 3, 4, 5 days and you have to start over. That's not how it's going to work well for us. We also want to make sure that we begin with low intensity. Why? Because going all in is not going to get us anywhere. Or you will in bed, right, for the next couple of days. Done that. Load wisely. For more than those 10 pounds looks great, and you see that picture on the magazine with that person lifting really, really heavy weights, and you feel really good and empowered. Our body's like, nah. Not doing that. And then we try, and then we have a lot of tissue repercussions. We have subluxations. We get wiped out. We have mast cell activation syndrome. Boom, histamine release, and then we are done, right? We have POTS. We overdo. We're not going to feel good. So load less. Start slow. That 1 pound is 1 pound heavier than you can do without anything on your hand. Okay, or the yellow TheraBand is 1 yellow TheraBand heavier than you can do without anything on your hand. And then establish a routine. Having your mat, having your equipment set is less energy that you will spend to get the whole thing set up, right? Roll the mat, get the weights out of the car. By the time you finish putting everything up, that was your exercise session done. Next day you just put it all away and that's your second exercise session. And it's okay if you have to start there. Right? Have it set up. Set a time of the day. Time of the, like, I'm a 5, 6 p.m. exerciser. Trust me, have tried the 5 a.m. thing. Does not work. I'm not even awake. I'm present, but not awake. For me, it doesn't work in the morning. For me, it's a 5, 6 p.m. thing. What works for you or each one of you is different. Just make it be your routine. Make it be like your date with yourself. Show up. The hardest part is showing up. If you have that day you don't feel good, show up on your mat, sit down. Show up on your bed if that's where you have to exercise initially. Sit down with your mat, with your exercise gear on, and say, okay, I'm here. Tomorrow's going to be a better day, but today I'm showing up with my exercise. So let's talk a bit about some adaptations. You have dysautonomia. You have POTS. You have to start lying down. You can't try to start standing. You're going to blood pool. You feel dizzy standing, you get tachycardia standing. That's not the best place to start. Start lying down. Lying down on your back, lying down on your side, legs elevated on a ball. Move on to a kneeling position, seated on your heels, assuming your ankles and your knees allow you to. If not, move on to a chair. Crisscross applesauce, squeeze the blood back in the brain. We do need that. You have chronic fatigue. That is another adaptation. Do what you can. Be mindful of yourself. Listen to your body. But sometimes our brains are afraid and they will say, oh, you can't do that. You can't do that. Try. Next day you will find out. Don't push. Just do one new thing at a time. That will take you further than doing the same thing. Definition of insanity, right? Same thing, expecting a different result. Be mindful of your specific injuries. You need to tape it. David presented greatly on it. You need to tape it. You need to put a brace on. I brace my both hands so I can do yoga, right? Because my fingers dislocate, my wrists sublux. If I don't tape, I can't do anything. I can't hold weights. So I have a special way to adapt to hold my weights. Let's incorporate rest periods wisely. Rest is as important as it is exercising. Now, I'm not talking about resting, lying down in bed and being there for a couple hours. That feels great, but doesn't take you anywhere. It's counterproductive in many ways. There is a need for it and a place for it. But rest in between exercises. Anywhere from 30 seconds to 2 minutes, depending on what you're trying to achieve, depending on what you need. But I'm not saying do an exercise and wait that long. Do an exercise for one body part. And I am more of a holistic, whole body type of activation person. That's how I work with my patients. But if you're focusing on the glutes, for example, now let's go ahead and work on shoulders for the next minute or two. You need a 30-second minute break in between just because you need it, your heart rate is elevated, take it, okay? That's when all the metabolites, the things that accumulate in your muscle when you exercise are flushed away, new blood comes in, the mitochondria, everyone I guess have heard at least of a mitochondria, that's the energy unit of your cell, will receive energy, reload, ready to shoot again, okay? And modify based on symptoms. Don't feel good today, it's gonna be a mat session. Feel better today, could be a standing session. Don't feel too good, cardio is out of question. But next day, if you feel better, you put your cardio session, even if it's 5 minutes. 5 minutes is better than nothing. 2 minutes is better than nothing. Okay, you don't need to start with a 30-minute session just because you read it somewhere. So let's talk about the 4 key components that I consider to be the keystones. There's a lot more to it. I just picked because I only got 20 minutes, right? So can't make it, you know? So ground reaction force, super important, right? For every action, there is an opposite and equal reaction, right? And that's, I guess, every single aspect of life as well, not only for ground reaction forces. What does essentially mean? The force applied to the ground or to a surface creates a equal opposite reaction into the body or into the body part you're pressing on. So if you mindfully press yourself against the ground, if you press your feet on where you're seated right now, press down on the ground, you feel that all the muscles kick in, right? It's different than just standing there. I mean, still it's happened, there is ground force reaction. It's not like disappearing for a minute. But why is that important? Facilitates motion, enhances joint stability, improves your proprioception, facilitates muscle activation, right? Press down. Reduces stress in hypermobile joints and shapes your interaction with the world, which is your spatial orientation. Come on. There you go. So, open chain, closed chain, and my favorite, pseudo-closed chain. You'll see why. Open chain, this. Your arm, your leg is free in the space, moving around. May increase the risk of injury for us. We don't know where limbs are in space sometimes. And it might generate what's called shearing forces, where the joint surfaces slide on each other, not in a healthy way. Closed chain exercise. Now your limbs are touching and pressing against a surface. It is a stable surface. You will enhance joint stability, will improve your proprioception, will reduce your risk of injuries. Yay, now we are talking. Now, I keep pressing the wrong button. I can't feel where my fingers are on this thing, so. It's serious, you guys have no idea. So the closed chain. The extremity being moved is now in contact with a moving surface. So it will give you a much better advantage. Now, obviously, you want to start with closed chain, make it stable, and then move on to dynamic stability. But why do I like it? Because it gives you even better proprioceptive feedback now in different ranges of the motion. Will provide you a dynamic feedback now, right? Because you're moving. It will improve your balance and coordination, the feedback into that joint, stabilizes your muscles and will promote better joint stability. It bridges that gap in between the open chain and the closed chain exercises and provide the freedom of, freedom of movement in progressive trains your stability now, right? Dynamic stability. So a couple examples I really wanted to put out there from the different perspectives. With a band, now that the donkey kick back there became a pseudo-closed chain exercises. That Pilates reformer or the tower with the springs just made it now have that proprioceptive feedback, so you have a better idea where you are in space. The ball on the wall, moving around, another good example. Now let's talk levers of movement. Pretty quick, there are 3 types. We're not going to physics here. Hate physics, never liked it, had to learn it because there was no way to learn this without it. There are 3 classes. All 3 classes are present in the human body, but the most efficient, the most common is the 3rd one, is like the elbow bending one, the 3rd level class, which is like a tweezer. And then the 2nd class is the most efficient, with the wheelbarrow, right? Which is illustrated by the calf. What is their role in stability? Bones, bones and muscles work together like levers to help us move. That makes us be able to lift, push, pull, move in general with more ease. What is the role in stability for this whole thing? It will give you mechanical advantage. It makes easier or harder to lift something or move something by changing the length of the lever, and like by changing the length, I don't mean chop any limbs, by all means. Don't go home and start saying the therapist there said that. I mean bending the limb to make it easier. So it's easy, quick. If you get your arm from the side of your body and you lift it up, you're gonna feel how much tension it puts on your joint. Now, if you bend your elbow and you do the same movement, it will make it easier. That's just another concept. It will decrease the force that your muscles need to use, and will also decrease the shearing forces, right? So that means the sliding of that joint that we spoke about being unhealthy is gonna be decreased. It's gonna be less painful. So that straight leg raise exercise is not gonna hurt the hip anymore. At least for me, it did when I was going through my hip instability phase. So we have jumping into isometrics, eccentric, concentric. Isometrics, everyone heard, everyone being told, is a great form of exercise, but when dysfunctional for EDS and HSD patients, it can make it harder to maintain an isometric hold, okay? Which potentially can lead to more pain and injury. Essentially, we don't change the length of the muscle on an isometric, by the way. On a concentric, thinking biceps, simple. Muscle gets short as the movement happens. The dysfunction compromises the myofascial extensibility, leading to compensatory movements and our biggest companion, muscle spasms. Then the eccentric, my favorite for working with patients initially, is when the muscle, now think biceps, now the triceps is contracting, the elbow is extending, the biceps is resisting to that triceps contraction, so the biceps is eccentrically contracting, becoming longer as it goes. When it is dysfunctional, it alters recruitment patterns and allows for uncontrolled movement. Who doesn't feel that, right? So takeaways. Eccentric training is better for people with EDS. Initially, we need them all. I add some isometric contractions in the different holds, in the different ranges. Why? Because isometric exercises only strengthen the muscle in between 5 and 15 degrees from the position you're holding at. So if you're only holding in one position, it's 5 or 15 degrees, done. You're only stronger 5 to 15 degrees on that position, done. You need to incorporate multi-range isometrics as well. So eccentric training will strengthen the tendons and ligaments, will improve or will generate more controlled movement, will improve your muscle strength overall by providing better support to the unstable joints, and will reduce joint stress. This is a race, 20 minutes. Okay, so wait, what about isometrics? Everyone talks about, it has a place. Please add those isometrics to the eccentric different holds, okay? It will help with strengthening as well. It is a low impact, has a place even on immediate post-operative for muscle activation, and it helps a lot with pain management as well. Overall exercise is actually awesome because it will help with pain modulation, okay? So moving is better than not moving. So just a quick show, different ranges. This is just a squat one. It doesn't need to be standing. We never start that strong with a patient. Let's put it all together, wrapping it up. Start with low repetitions, right? David did a great job showing those progressions there. I'll be happy to talk to you guys in detail with it. Please reach out. But start with low reps. 4 reps is your thing, do 4 reps. Because if you have 5 exercises with 4 repetitions, if you're kind of good in math like me, you will have to use your fingers, but you will know you have actually loaded your muscle more than just 4 times, okay? You're gonna begin with low intensity. Make sure that it's as intense as you can handle, which means that can be very different for each one of us. Slow and low intensity is secret. So no rush. Think about, focus on that movement. Mind-body connection is key. Establish the routine we spoke about, roll the mat, show up every day, even if it's to sit down and prime your brain. Build new neural pathways in your brain to become more comfortable with it. Load wisely. Use light resistance initially, and it's about really utilizing your muscles correctly. And prioritize closed chain and pseudo closed chain to build stability. Focus on eccentric movements initially. There is a place for concentric. We'll show an example pretty quick soon. Choose isometric exercises in multi-positions, and I add holds to the exercises when I prescribe, depending on what I'm working with patients. Shorten the resistance arm. If this is difficult, bend it here, get it there. That straight leg raise with the connected band is difficult, bend the knee, and you have the same movement with a better response. And utilize ground reaction force. Utilize that pressure, get that feedback from the surface you're in contact with, you're gonna have better muscle activation. Get in there. Okay, this is my great friend, one of my movement specialists, Drew, from the Monkey Body. You guys might have heard of him. So Drew was my model. What we did with Drew, we essentially, am I pressing the right thing? You guys can see that. I'm not good with these things. We moved the resistance to a little higher or a little below his elbow to just demonstrate how you can shorten the lever. We also moved it up on his leg as well to show another variation of it. This is a pseudo closed chain, that's a band. And what I would do for him, in order to get that eccentric phase, I would bring his arm down. If I'm focusing on shoulder extension, let's just keep it simple as that. I would help him to bring his arm down. I would remove my hand and I would let him control. And I could add that isometric component now and say, okay, hold there, good, maintain your posture, are your abs engaged, breathe, good, next, good, stop there. And that's how we would do with the leg and with the hand or with the arm. And in conclusion, I have seen hundreds of patients over my last 13 years. Like I said, I'm a patient myself. I see complex cases day in, day out in the clinic with mast cell, POTS, CCI, AAI, pelvic congestion syndromes. I have to adapt for each and every specific need. So there's no way I could bring to you guys here and say, do this. It's never gonna work for all of you. But I can tell you that these 4 concepts are keystones to a well-designed program, along with other aspects, nutrition, medication, and anything else that it might be needed for each case. While they're not the only things, the only 4 components, I consider them very important for the holistic approach to improve quality of life for all of you. Thank you so much. I appreciate you guys giving me your attention. Got some references there. Thank you all.